Hi guys, I am back with another FMG question. All of the following occurs because of a prostaglandin use except option A, excess water retention, option B, flushes, option C, increased motility of bowel, and option D is the nausea. So pause and try to answer this question because this question is also slightly easy. So, in order to understand the question, we need to first understand what are prostaglandins. So, prostaglandins are a group of bioactive compounds which are produced whenever there is whenever there is a cellular damage. Okay, and as you can see in the right of the right of the slide, you can see the production of prostaglandins. Okay, so the main amino acid involved in the production of prostaglandin is the arachidonic acid. Okay, and arachidonic acid, it is a very important acid, amino acid. Okay, and and whenever there is COX, that is a cyclooxygenase enzyme. Okay, so in the presence of COX-1 and COX-2, this arachidonic acid, it gets converted into the prostaglandin H2. Okay, this is a subtype of a prostaglandin, and then we get the PGD2, E2, I2, and thromboxane. Okay. Now, function. So, inflammation. Very first and foremost is the inflammation. Uh, Inflammatory response by promoting vasodilation, increased blood flow, and enhanced permeability of blood vessels. Okay. They also contribute to recruitment and activation of immune cells at the site of inflammation. Okay. Pain and fever. Okay. Prostaglandins sensitize pain receptors, causing increased pain reposition. Okay, vasodilation. Vaso, Prostaglandins can cause blood vessels to dilate, causing increased blood flow and reduced vascularization. Okay, increased blood flow, and this also causes flushing. Okay, flushing means blushing, kind of. Okay, so then platelet aggregation and clotting. Okay, so these prostaglandins can both stimulate, promote, and inhibit platelet aggregation and blood clotting. Okay, and uterine contraction. Prostaglandins, particularly PGE2 and PGF2 alpha, are involved in stimulating the uterine contraction during labor and delivery. Okay, and they play a crucial role in the initiation and progression of childbirth. Okay, guys. Gastrointestinal effects. Uh, Prostaglandins contribute to maintaining the integrity of the gastric mucosa by promoting mucus secretion. They enhance the mucus secretion, blood flow, and inhibiting acid secretion. Okay, like these drugs which contain the prostaglandin are used in the in the treatment of acidity. Okay, they help protect the stomach lining and regulate gastric motility. Okay. Now coming to the kidney functions. So prostaglandin regulate renal blood flow. Okay. They also regulate the renal blood flow and GFR, glomerular filtration rate. They are involved in maintaining the balance between the of salt and water in the kidneys. Okay. In the kidney and play a role in blood pressure regulation. That is, they help in causing the diuresis. Diuresis means excretion of urine. Okay, so now respiratory system. So prostaglandins can affect bronchial smooth muscle tone and contribute to bronchoconstriction or bronchodilation. Okay, it can cause both bronchoconstriction as well as bronchodilation, depending on the specific prostaglandin and the receptor involved. Okay. Now there are various types of prostaglandins available in our body. So you should know about this. So prostaglandin E, F, D, I, H, A, J. Okay. So read it. Now, what is hemostasis? So damage to the wall is repaired by hemostasis, which involves formation of thrombus clot at the site of vessel injury. Okay. Now, primary hemostasis forms a weak platelet plug and is caused by interaction between the platelets and the vessel wall. Secondary hemostasis stabilizes the platelet plug and is caused by coagulation cascade. Okay. Now, what are the steps? What are the steps in the primary hemostasis? So, first is a transient vasoconstriction of the blood of the damaged vessel. Second is a platelet adhesion to the surface of a disrupted vessel. Step 3 is the platelet degranulation. Step 4 is the platelet aggregation. Okay. Before moving on in this hemostasis, I should remind you that the primary hemostasis is caused by the interaction between the vessel wall, that is the damaged vessel wall, and the platelets. Okay. So now, secondary hemostasis steps. So this secondary hemostasis is required to make the platelet plug strong. And how does this occur? This occurs by the coagulation cascade. And at last there is a formation of fibrinogen. Sorry, there is a formation of fibrin from the fibrinogen. Okay. Now this fibrin then cross links to the platelet and causes the fibrin thrombus, a stable platelet fibrin thrombus. Okay. Now factors. Now the coagulation cascade, it consists of various factors. So uh, activation of this uh, this of these factors requires some of the predisposing factors. So now, first is the exposure to an activating substance. Second is the tissue thromboblast activate factor 7, uh, which causes the activation of extrinsic pathway. Then the exposure of a platelet to the subendothelial tissue collagen. So it causes the factor 12, that is called Hajime factor, to activate, and causes the intrinsic pathway to be uh, activated. And phospholipids surfaces of the platelet, and calcium. Okay, calcium is also very important in the platelet aggregation as well as the adhesion. Okay, now this slide is very important as it has all the information regarding the thrombosis, basically all. Okay, so prothrombotic substances and the antithrombotic substances. So prothrombotic substances are the substances which promote the thrombosis. Okay, and these include one Willebrand factor, thromboxane A2, thromboplastin factor 5, platelet activating factor, and plasminogen activator inhibitor. Okay. Now, antithrombotic substances are the substances which inhibit the thrombosis. Okay, and these include the prostaglandin, also known as the PGI2, that is the prostaglandin of I2 category. Now, thrombomodulin, antithrombin, plasminogen activator, and heparin or heparin-like substances. Okay. Now, let's get back to the question. So, in option A, there is a excessive water retention. Actually, these prostaglandins generally do not cause water in retention. In fact, they can have a diuretic effect, meaning they promote the excretion of water and electrolytes by the kidney. Therefore, excessive water retention is not typically associated with the prostaglandin use. Now, option B, flushes. Flushes it is caused by the vasodilation. Okay, and if it is more commonly associated with certain prostaglandin analogs like misoprostol, used in the management of conditions like gastric ulcers or labor induction. Now, option C has increased motility of bowel. Prostaglandins can stimulate smooth muscle contraction, including those in the GIT. This increased motility can lead to enhanced bowel movements and may be used therapeutically to treat conditions like constipation. Okay. Option D, nausea. Nausea can be a potential side effect of prostaglandin use. It is not uncommon for individuals to experience GI disturbances, including nausea or vomiting, when using certain prostaglandin medication. So, so our correct answer is option A, excess water retention. So, thank you guys for watching. Bye.